All right. Hello, everyone. Thanks for giving us your time and attention this afternoon. We wanted to present to you the work that's been happening surrounding Oklahoma City Public Schools. And my name is Addison Davis, and I also have Christa, Bellack, Tram, and Rahma Osman with me. I'll let them introduce themselves now.
Hi, everyone. My name is Christa Bellack. I'm a second-year medical student.
Hi, everyone. My name is Tram. I'm a third-year medical student.
Hey, everyone. My name is Rahma. I am a IPE project manager in the Office of Interdisciplinary Programs.
Thank you. And I forgot to mention, but I am a second-year MHA student. So the situation at hand, when we began to look at what Oklahoma City Public Schools work is today, really began with the expansion of Medicaid. So we were one of the last 14 states in the nation to expand Medicaid. And additionally, when this happened, the stars aligned, and we were also had the opportunity to obtain some FMAP dollars. And what those dollars are a federal allotment to support community-based initiatives within Medicaid-dense populations. As we know, and I'll talk about in a little bit, our population, particularly at the Oklahoma City neighborhood area, is particularly a safety net area and really has a predominant number of Medicaid patients in our adult tower and in the children's hospital as well. So when we got these FMAP dollars, we really wanted to determine a way at OU Health to establish a clinical program that sought to decrease utilization of our emergency department, but also supported the Medicaid population as they really came to have health coverage for the first time. So as we look at the area for choosing, we ended up choosing Cesar Chavez. And I wanted to include this picture as why we chose that school to really begin this clinical outreach opportunity with the allotment of our FMAP dollars was because we saw, as you can see on the screen, a really high density of children's emergency departments utilizations. This red box right here indicates the zip code 73129. This was pulled from OU Health Data Analytics. And in that area, there was also a high frequency of EMS calls from their school, Cesar Chavez. In 2019, they actually had 500 in the school year. So from 2019 to 2020, 500 EMS calls from the school alone. So that's a lot. And when we did a deep dive into the data as to what these children were actually coming to the emergency department for, they were coming in for low acuity needs. And I wanted to show you some of those on this next slide. When we went into the zip code and looked at, okay, where can we help mitigate some of these visits to the emergency department and really direct some of this care? It ended up being that asthma was our number one reason for these children's coming to the emergency department, followed by headaches, sickle cell, they had upper respiratory infections, and even UTIs. So now that I've kind of talked about the situation at hand, I want to hand it over to Rahma to talk about what opportunity there was for interprofessional collaboration to how we could reach this population.
Thank you, Addie. So as Addie mentioned, in July of 2021, a work group consisting of stakeholders from OU Health, the Office of Interdisciplinary Programs, and Oklahoma City Public Schools came together and began meeting on a weekly basis to brainstorm how our organizations can work together to best serve the community of Cesar Chavez Elementary School, which is one of the schools that was chosen to be our pilot site. And through our assessments, we also ensured to use the IPE competencies as our guiding principles. And our project specifically addressed two competencies in particular. The first one being teams and teamwork by asking ourselves how we can develop services that will support not only collaborative practice, but also team effectiveness. And second, communication by thinking about how we can ensure our services will encourage health profession students to not only engage in communication within their teams, but also using those skills to optimize the delivery of care for the community served. So with these two competencies in mind, along with the data from OU Health that we received, we identified three major focus areas that are shown on this slide. The first one being increasing health literacy among families by, for example, having our interprofessional student teams offer education sessions on Medicaid expansion, managing diabetes, and eating healthy. Two, a need to promote wellness by offering low-stake preventive assessments such as, but not limited to, BMI checks and glucose checks by our interprofessional student teams. And then the last one, building an education pipeline by offering experiential learning activities for the kids at Cesar Chavez and providing exposure to multiple health profession careers. And as we continue this work, our goal is to develop a menu of services that is replicable and can be implemented at all Oklahoma City public schools and beyond. Now I'll hand it over to Christa, who will give a little bit more information about the assessment that was done.
Thank you, Rahma. At each event at Cesar Chavez, we had a baseline goal to provide a minimum of one health wellness intervention and one health literacy education service to each participant that attended. So this would include student-led health screenings and educational resources on both Medicaid expansion and also interpreting what their health screening results would mean. And in every aspect of these events, every time we arrived, we would utilize more than 2 health profession programs from the OUHSC campus to deliver team-based care. In November of 2021, if we could go to the next slide, sorry. We implemented our first interdisciplinary health fair at Cesar Chavez Elementary School, and we had student participation from College of Nursing, College of Allied Health, Medicine, Dentistry, and Public Health, and we were able to serve over 97 families. Like Rahma mentioned, interprofessional teamwork and communication skills were crucial not only when performing the screenings, but also during event planning and brainstorming our logistics. Each profession had a team leader who served as their representative, and we all worked together to plan the event and also serve at the event. Through this, we were able to learn more about the scope of practice of each profession and various ways we could work synergistically to improve our processes. For example, previously, we planned to have our MD students, our PA students, and nursing separately perform screenings for blood pressure, glucose, and height and weight. But upon evaluation of our workflow, we created wellness stations, which incorporated members of each profession. Not only would this increase screening proficiency, but it would also allow for 3 programs to interact and collaborate within their scope of practice. Next slide. So our goal was to provide health information for parents and students, improve access to local healthcare services through Medicaid enrollment and local clinics, and also further opportunities for patients to expand their health literacy. In turn, we also hoped to increase the use of primary care and non-emergent health services, and overall to prevent unnecessary trips to the emergency department. And now I'll hand it over to Tram to talk about some of our assessments.
Thank you, Christa. So during this pilot implementation of our event, there were obviously various issues that we had anticipated from prior experience with community events. And so we tried to address these proactively. So as it was our first substantial direct contact with this particular community, we decided to adopt a more kind of active needs assessment using anecdotal data that allowed us to more flexibility to modify our workflow in real time and plan for future events. So for example, many patients were very interested in receiving dental care at our first event while there was less traffic through the nutrition station. So to us, this demonstrated a need to expand our dental services for subsequent events while simultaneously providing more just general education and awareness on the importance of nutrition and nutritional health to stimulate more interest in our patient population. For patients who screened positive in any of our booths, consultations with our faculty providers and referrals were arranged as needed. Since this population is predominantly Spanish-speaking, we specifically sought out student volunteers who were bilingual and able to interpret for each of our screening booths. And finally, we understood that one of the biggest hurdles would be getting people through the doors in the first place. So we attempted to address this by offering free meals to all of our participants who came through. So while we considered the pilot event a success overall, we still have much work to do. Subsequent events in the spring semester saw a significant drop in engagement and participation from the community, which led us to kind of reassess our priorities and programming. Another consideration is to diversify our screening services and offer different ones each time to avoid applying the same screenings on the same people, which ultimately would not maximize their access to care and would just be redundant. With this adaptation, in addition to incentives of free resources and food, we hope to increase our participant attendance. This expansion in services and participation will also require the use of more interpreters. So we're seeking a collaboration with the Office of Diversity, Inclusion, and Equity, as well as various Spanish-speaking student associations, both on the Health Sciences Center and the Norman campuses, to develop a more sustainable pool of interpretation services. None of this would have been possible without our sponsors and collaborators. So we just want to extend a sincere thank you to OKC Public Schools and OU Health for allowing us this opportunity to get to know our community better, to the Office of Interdisciplinary Programs for facilitating our partnerships and providing a base for us to launch our ideas and initiatives, and to the Unity Clinic for recruiting, onboarding, and coordinating our interprofessional volunteers, faculty, and providers that brought our event to life. Thank you for your time.